Hey ladies, Dr. Madeline Turner. Let's talk about some common things that I hear in my practice. I see a lot of pregnant and postpartum moms, and they're coming in telling me the craziest stuff that their friends or their other providers are telling them. Number one, top of the list is that my pregnancy pains, the pains I'm experiencing through this pregnancy, are normal and that I can't do anything about them. Absolutely not true. They are common through pregnancy because your body changes so fast through that 9 months, essentially 9 months, a little bit more time period, and it's going to be changing pretty fast postpartum as well. So it's common to have aches and pains. They're going to show up. This is, if you imagine babies hanging out here in the uterus, this is your low back from the side, so looking this way. And then there is a ligament that attaches where baby is in that uterus to the front part of the bony part in front of your in your pelvic area. So you're connected from front to back, and you can get tension that can turn that ligament and give you pain. You can get that pain that travels through that butt all the way down to the low back as your body is accommodating baby and as baby's growing and preparing to come earthside, but you can absolutely manage it. Manage it with, I gave you top 3 exercises that you can do to help manage your pain at home through your pregnancy. You can also check to find a Webster certified chiropractor who will assess this area in particular. It's extra training to help manage your pain during your pregnancy. And 3, you can check out for a women's specific pelvic floor physical therapist. So pregnancy pains are common but not normal, and you can manage them through your pregnancy. Please know that. Number 2, another one I hear a lot of times is that my body's too small or my baby's too big to fit through the birth canal. And I just challenge you to ask the people who are asking you that, 1, to show you the research that really supports that, and 2, let's look at it mechanically, right? So a lot of times, just right now, I would say not very much of the population is going to a Webster certified chiropractor or a women's specific pelvic floor physical therapist during their pregnancy. So what me as a Webster certified chiropractor does, and then a women's specific pelvic floor PT, is we're looking at the muscles, the bones, your uterus, ligaments in that area, and if they're working properly. The research shows if you're getting regular Webster chiropractic adjustments throughout your pregnancy, your labor is shorter, it has less medical interventions, and same thing especially if you're coupling up with women's specific pelvic floor physical therapy, which is going to work way more on the muscles that are holding up that pelvic floor at the bottom. So I recommend checking out both if you haven't went down that path. But baby got inside, baby can get out. Of course, this is not medical advice for everyone. There's specific or different case scenarios. But those exercises that I gave you for pain will also help keep motion in these areas to keep the hips moving, which is what we want as baby's getting ready to come earthside for the best chance for baby to fit through your birth canal. So there are things that we can do. So please know that. Last one that I hear quite frequently is, my doctor told me I'm going to tear. There's no ifs, ands, or buts around it. And again, that's common, not normal. So pelvic floor physical therapists, women specific, are great in this area. They work on that tissue that is down where baby is going to be expanding and coming out, and they can work with you and your partner on how to prep that tissue before birth to decrease your risk of maybe tearing or ripping, which can be quite scared as we enter that birthing process, and I totally get that. But just know that there are tools that you can use to help prep that area to decrease the likeliness of that happening. And laboring position is huge within that, and if baby's going to fit through birth canal as well. So being supported by your provider, that you're going to be able to move in different positions on what's right for you through in your birthing process. So top 3, pregnancy pains, I can't do anything about it, throw it out. You can do exercises, you can see Webster certified chiropractors and pelvic floor physical therapists, which can absolutely help you manage your pregnancy pains, and you do not have to go through your pregnancy with them. Baby won't fit through your birth canal because you're too tiny and baby's too big, or vice versa, or one of them. Not true. Let's make sure your hips and alignment are moving properly. Let's make sure your pelvic floor is able to relax enough to let that process happen. And 3, I'm absolutely gonna rip. Let's prep the tissue just like we would train for anything else. We would train for a marathon, we would train for birth, our body for birth physically, and even the tissues in that area. So you can absolutely do things in all 3 categories. Those are some common things that I hear every day in my practice from my pregnant and postpartum moms. So let me know, have you heard those or similar ones or different ones, and I can cover them next time.